You've received your medical clearance from your doctor to begin exercising, but you don't really know what to do. They may have told you to walk, just get moving, but that's ominous when you are recovering from cancer surgery and treatment. So as long as you have your medical clearance, I suggest you begin with some very gentle range of motion exercises, starting with your affected side. So that's the side that you've either had radiation, mastectomy, reconstruction, node dissection. And I'm going to use a chair. You can use a kitchen counter, sofa, something stable that you can lean onto. Hinge at the hips. You're always going to think of drawing your belly button towards your spine, and you want to keep your head and neck in alignment, and just don't put any extra tension on your neck. And begin by just letting your arm go back and forth, kind of like an elephant's trunk. I'm going to look down because I want to keep my neck relaxed. This shouldn't cause any pain or discomfort. We're just getting the joint moving, getting some synovial fluid in there, lubricating the joint. So let's say you do about 10 of these, and then we're going to go to what I'm going to call a pendulum swing. So imagine your upper arm where it inserts into the shoulder girdle, just going in a circular motion. It's called circumduction. You don't need to use any force, just let gravity move your arm, and then go ahead and go the other direction. And I'll go ahead and assume we're doing 10 of each of these. Now from there, we're going to go to something that's more of a stretch. And I'm going to use the other arm just because it's easier to show you in this video. I'm going to start with a side wall walk. So it's great if you can do this in front of a mirror, but if you can't, imagine that you have two panes of glass that your arm has to stay within so you don't go forward or backward. You're going to look straight ahead, belly button drawn in, and you'll walk toward the wall. We call this a side wall walk. I'm going to move back just so you can see how my arm is placed. And from there, you're going to breathe into that stretch. There should be no pain, only a gentle or mild stretching sensation. And you may find that you can't go very far up the wall. That's okay. You'll just keep trying to go a little bit further each time you do this. So this is a side wall walk. Try and hold this for 20 to 30 seconds. Alternatively, we have a forward wall walk, and I'm going to use my other arm now to show you this. And I'm going to walk toward the wall, once again, not going over to the side, but thinking about those two panes of glass and holding it at the point that I feel the tension under my armpit or any discomfort in my chest wall. And I'm going to take nice deep breaths and hold that stretch. So these two particular exercises, the forward wall walk and the side wall walk, are going to help you with range of motion in what we call flexion and abduction. And you may not be aware of how this impacts your day-to-day life, but things like reaching into a cupboard or having to reach up onto a shelf, activities of daily living that we take for granted until we can't do them or it becomes more difficult to do them. So this is a great place to start as you begin your post-surgical exercise program.